Welcome again. Today is the last and the final lecture of the Labor Code lecture series organized by Labor Access and Lawyers for Labor. Today, Jasoon will be joining us and will be taking the lecture on the Occupational Safety, Health and Working Conditions Code of 2020. The initial lectures in this series included Industrial Relations Code, which was given by Professor Babu Matthew, the Wage Code by Advocate Gayatri Singh, and the Social Security Code, again by Professor Babu Matthew. Jasoon, we're really excited that you're here today. Today's session will be moderated by Sundar Babu. I would like to introduce Sundar Babu first. Sundar Babu Nagappan is a social activist, a public policy analyst, and a grassroots educator. Since 1998, he has been actively involved in various ongoing studies, action researches, training, fact-finding, evaluations. He's currently affiliated with the National Secretariat of the Working People's Coalition. Sundar Babu, are you with us?
Yeah, thank you. Because my mic was muted, so that's why I couldn't take up. So, welcome everybody. I welcome all on behalf of the Labor Access and the Lawyers for Labor, as well as the India Labor Line and the Working People's Coalition to this Labor Code lecture series. So this evening, we have a lecture on Occupational Safety, Health and Working Conditions Code 2020 by Jasoon Chelat. So I just want to, as a formality, I just want to introduce her. She's a human rights activist, a lawyer, and Jasoon currently is also a doctoral researcher at the Center for Labor Studies at the National Law School of India, University, Bangalore. Jasoon, her main research interests are gendered areas of work, which include reproductive labor, intimate labor, or care work typically performed by women within the family. Jasoon's interests in the intersection Jason's interests are in the intersection of gender and labor and the differences between formal and informal workers in their organizational strategies and their engagement with the law. Jason has worked with few labor rights organizations in the electronics industry, like the CivicUp India, and also with the LexisNexis company. Jason has also previously been a faculty of law at the Tamil Nadu National Law University. So I hope Jason would provide some valuable insights into the current state and the future direction in the field. So over to you, Jason.
Yes, thank you. Thank you. I hope you can hear me. I will start now. I have a PPT prepared, so I'll try and share my screen first.
Hope the introduction was fine.
Sure. Yes, of course. Yeah.
Okay.
Occupational Health and Safety Code is, it's one of the largest in terms of how much text there is. As you all know, it was mentioned that this was the last lecture. So I'm sure everybody knows that the current status is of all the codes, not just the Occupational Health and Safety Code, is that they have been passed, but they have not been notified. So they're not enforced yet, but they have already been passed. Occupational Health and Safety Code is also the code that repeals the most number of laws that existed in labor law, and it repeals the Factories Act, Dock Workers Act, Plantation Labor Act, Contract Labor Act, Interstate Migrant Workers Act, Working Journalists Act, and so on and so forth, because this is the code that is supposed to take care of working conditions like hours of work, leave, annual leave, etc., as well as what we usually understand through when we say safety standards and things like that. So in addition to being the largest code, it's also the code that repeals all these laws that already exist. Now, when I spoke to Professor Babu about how to sort of approach this session, and he said that it might be useful to sort of think about the possibilities, in the sense that the code exists in a particular form. And I'm sure you have heard from others that in terms of like the other labor codes as well, what is interesting is that a lot of the time, it's not really anything new that has been enacted. It's sort of a compilation of different laws that already existed, coupled with maybe some new changes, etc. So if you look at it from that perspective, it's true for occupational health and safety as well. Although we can list all these laws that have been repealed, some similar provisions are still retained. But the challenge with the Occupational Health and Safety Code, as even compared to the other codes, is that there is a huge amount of centralization of power, along with a lot of uncertainty that has been inserted into the code because of that. So it's hard to sort of pinpoint the problems with a specific issue, because it's very ambiguous and it's also left to the center to decide. So let me illustrate that first. So essentially, when we talk about OSH, we talk about safety standards and welfare measures. So this used to be taken care of by Factories Act and mostly Factories Act. Now here, which again, the state government would frame rules under the Factories Act, and that would be applicable to that particular industry. What the code now does is that it gives most of this rule-making power to the center. So by section 18, the code says that by notification, the standards of occupational health and safety for workplaces, for factory, mines, dock work, BD, cigar, most of the things that we listed out in the beginning will now be with the center. And in matters, with respect to matters specified in Schedule 2. Again, when we look at Schedule 2, it's mostly everything that was already specifically listed out in the Factories Act. Now, this by itself, if we look at it, is not a big issue, because we could argue that, okay, then all the central government needs to do is sort of make those rules in accordance with best practices, etc. But the problem is that it already existed in the Factories Act. Factories Act already had extensive provisions related to machinery, welfare facilities, lighting, ventilation, and things like that. This is not reproduced. Rather, it is left to the appropriate government to set standards. And at the same time, it has also taken it from the states to the central government's prerogative. This is true also for things like under section 23 and 24. This is also true for things like cleanliness, hygiene, drinking water, welfare facilities such as this. And then, other welfare facilities like washing, separate washing places for men and women, locker rooms for men and women, different latrines for men and women, etc., men and women workers, etc., which were in the body of the statute, have now been relegated to rulemaking. And that rulemaking has been taken from the appropriate government to the central government. So this makes it quite difficult to sort of say anything about the standards itself, because the standards are not there anymore. Then another issue is that there is powers to exempt from the OSH code, which is not something that is unique to the OSH code. Usually all legislations always have this sort of exemption clause. But what has happened here is that in addition to the general power to exempt, which is there in Factories Act and in the other acts that were already mentioned, this has been extended to if the state government is satisfied in public interest that it is necessary to create more economic activities and employment opportunities. So initially, the power to exempt was limited to things like having a public emergency, whether by war or external aggression, disturbance, and things like that. But now they have extended it to also things like economic. If you want more economic opportunity, then you can have exemptions to the application of the code, which is again a much wider exemption. Again, but if you think about it, exemptions are not really something that is unique to this legislation, but it's just that it seems like they have expanded the ambit. One major issue that most people have already pointed out is that it raises the threshold level for the application of the law almost across the board. So for people who are familiar with Factories Act, you know that you had a limit for the application of the law. Now this threshold, as in if you had 10 workers and you had a manufacturing process that used power, then you would come under the ambit of Factories Act. Or if you had 20 workers and you did not have the use of power in the manufacturing process. Now, of course, this has already been, as it existed in the Factories Act, had already been criticized quite a bit, because if you put threshold levels for application, it already completely eliminates the possibility that any smaller unit will come under the ambit of any regulation at all. So already threshold levels had been criticized when they existed in the Factories Act, but in the code, not only have these threshold levels been retained, they have also been increased. So now more units are out of the ambit of the safety and welfare provisions under the code, from 10 to 20 and from 20 to 40. Another thing is that if you look at this, I don't know if this is, again, this is introducing ambiguity a little bit, but it is difficult to say how it will play out. Another aspect is that it defines worker and employee separately. And worker, for worker, it uses the definition that is more closer to the Industrial Disputes Act. which uses things like manual, unskilled, skilled, technical, operational, etc., etc. Whereas in the erstwhile Factories Act, you only needed to be a workman who was engaged in the manufacturing process in some way. This by itself, again, doesn't mean that workers might be excluded, but it's still kind of a, it's kind of an ambiguous sort of decision on why the definition in the Factories Act could not have been reproduced here. Similarly, it also defines employee differently from worker, whereas in the case of employee, they have included managerial and administrative workers as well. In addition to this, they have also separately defined audiovisual worker, cine worker, etc., separately. So it seems like if the idea of the code was to bring in clarity and bring in laws that would be applicable to whole host of workers without ambiguity, then it feels like introducing so many definitions may not have been the best way to sort of do it. Another thing that I found interesting was that when you look at the chapter on duties, what they have used is the term employer and employee, and they haven't used the term worker. But when it comes to the application threshold, they have used the term worker. Again, there is no sort of, it's difficult to discern why these different definitions have been used in different parts of the code, or why there is the need to introduce these dual definitions everywhere. One of the major problems I feel that is clearer than the other ones is in terms of contract labor. So already we mentioned how threshold levels for application were increased, and this is true for contract labor as well. Contract labor abolition used to be applicable if you had more than 20 workers. Now this has been increased to 50 workers. Of course, that puts more units out of the ambit of regulation, like I said earlier. But what is interesting to note is that instead of going with the previous definition of, where contract labor was not allowed, which talks about, things like if work is of a perennial nature, if regular employees are performing that work, etc., etc. Here, they have used a different definition. They have said that the code prohibits contract labor in the case of a core activity. And the definition of a core activity has been given as any activity for which the establishment is set up and includes any activity which is essential or necessary to such activity. But immediately after saying that, they have listed a whole bunch of non-core activities. Now, if you look at the non-core activities, you can, anybody who has worked with labor for some time, labor or labor law for some time, can see that this is already places where, areas where contract labor is used very heavily, such as sanitation, sweeping, watch and ward, canteens, loading, unloading, and then all those sort of occupations for contract labor is already very heavily used, which means that if this law comes into force, then it will be fully legal to have contract labor in all these occupations. In addition to this, they also allow, the code explicitly allows for contract labor to be used even for something that is identified as a core activity. Now, it just means that they have to they have to fulfill certain conditions that is there in the Act. But if you look at the preconditions for that, they are also pretty widely defined. So that means that if it is ordinarily done through the contractor, you can keep doing it. if you don't require full-time workers for the major part of the working day, you can still use contract labor. Even if you can argue that your volume of work has increased in the core activity, then also you can use contract labor. So in the end, it feels like more of a permissive provision than a prohibited provision when it comes to contract labor. So they have increased the threshold, and basically the code lists out places where contract labor can be used. So it's sort of a different nature of provision where it's like it's permitted in all these places rather than saying it's not permitted, if I make myself clear. Then for interstate migrant workers, also it has been subsumed into this code. One good thing is that it also now includes people who have come on their own to a different state. So it doesn't need, you no longer is there a definition requirement of a contractor or, some intermediary. Even if you have come on your own to a different state, you're still considered interstate migrant worker. But again, threshold level has been increased. Interstate migrant workmen had 10 as the initial threshold. The code brings it up to 10. Again, the same thing with a lot of the other provisions that we mentioned. Things that were listed out in the body of the statute, like wage rate, facilities to be given to the interstate migrant worker, responsibility of payment of wages, etc., have been relegated into broader terms like, okay, suitable conditions of work should be given, report if there are reporting requirements for injury, serious bodily harm, etc. Whereas, things like there should be suitable residential accommodation, you should provide medical facilities, you should provide protective clothing, etc., has been removed. And the reason for that removal is unclear. Also, another thing that happens is that in the case of interstate migrant workmen, there were two kinds of allowances that they were entitled to. One is journey allowance and the other is displacement allowance. The code only retains journey allowance and does not retain displacement allowance. Journey allowance is, they make the journey, so they need to be given some money for, the travel, because they have, not for the travel, but, because they have traveled from another state to reach here. Then displacement allowance is because they're displaced from their own residence and need to start a new life. They need to also be provided displacement allowance. But for some reason, only journey allowance has been retained. There are some provisions again in the interstate migrant workers sort of area, which is that they have said that, but again, they're in the nature of enabling provisions. It's not that they're already provided. It's stating that the appropriate government may frame schemes for extending benefits of PDS, portability of construction cess, etc. There has also been, we know that in the case of interstate migrant workers, one of the major challenges for making policy is that nobody has any idea about, about the data related to interstate migrant workers. So they have also said that studies may be conducted by appropriate governments, but again, this is again an enabling provision. Safety committees, safety management, workers' participation, safety management, they are retained. But again, there are some specific requirements that do not find their place in the code itself. One is that there should be a safety committee set up in every factory where hazardous substances are being used or handled. This is not there in the code. Setting up of the safety committee has been left to the appropriate government again. So it's not, one can't say it's not there, but it has been removed from the body of the legislation where it usually exists. One major issue in this OSH code, which might change the way labor departments function, and I think many people may already be familiar with this, is that instead of having an inspection scheme where a labor inspector can go and inspect units, etc., in his jurisdiction, what they have said is that now this should be based on a web-based system. So the labor department cannot identify for themselves which units need inspection. It will be determined by a web-based system. Now, again, this by itself is not a problem in the sense that if the web-based system is just and it makes sure that all units are inspected regularly, then it may be good, but it doesn't make any prescriptions as to how this web-based system should be made with respect to the algorithm that's kind of figures out how to select a unit for inspection. We know that algorithms can also be biased. Algorithms can also have exclusionary provisions. For example, an algorithm can say a factory with less than 50 workers need not be selected. And then this means that regardless of whatever safety issues may be going on in that factory, they are never inspected and they're never selected by the algorithm. So, and this kind of precludes the possibility of, say, something has happened in the factory, and then, a union member approaches the labor inspector or informs the labor inspector, and the labor inspector comes and inspects the factory, which often happens and has happened happens in some cases, and in some cases does work. But this kind of precludes that possibility because the labor inspector's power is then restricted to only those firms that are selected by these web-based algorithms. Okay. This doesn't mean that there are no possibilities at all within the OSH code through which some positive sort of measures can still be arrived at either through the states or by creatively interpreting these provisions. One major factor that was a success of I don't want to say lobbying, but a success of criticisms to an earlier version of the code was that they limited working hours to 8 hours in a day. So initially in the 2019 version, this working hours were also left to the appropriate government to decide. But in this version, they have said that it is limited to 8 hours in a day. But unfortunately, when the rules came out, the draft rules, the rules are still in draft stage, they allow for more than 12 hours in a day. In the sense that they say that although the code says 8 hours, when the rules came out, in intervals of rest and work, they have said that if you're including intervals of rest and work, then the spread over may be up to 12 hours in a day. Then, in addition to that, they have also included some exceptions to even the 12 hours rule, in the sense that you can even make a worker work for more than 10 hours in certain cases. And these certain cases are things like urgent repair work, exceptional pressure of work, exceptional press of work, which is that there's a huge amount of work at that point, or it's like seasonal work, etc., etc., or fixed seasons have greater volumes of work, then you can have more than 12 hours of work as well. So this is a case where the rules seem to be in contradiction to the code itself. There is letter of appointment has been introduced, which is a good thing, because it means that you can know your terms and conditions as soon as you are engaged in the work, which is always good. But at the same time, it also gives some ambit for appropriate government, which in many cases might be a state government, to have the appointment letter include many aspects, such as, for example, we can include that in the case of termination, such and such could be the reasons for termination. Or we could specify that in the case of termination, then the principles of natural justice should be served. Because if we sort of write down that these are the reasons for which your service may not be terminated in the appointment letter itself, then it kind of opens up an avenue for arguing that if you are terminated, then it should follow the principles of natural justice. I'm sure many of you must be familiar with the Industrial Standing Orders Act, where a lot of terms and conditions have been listed out for different employments. If you can say in the rules for the appointment letter that standing orders should be relying on the standing orders for a particular employment, the terms and conditions, etc., should be reflected in the appointment letter, then there is a possibility that the appointment letter can be used as an avenue to open up the application of principles of natural justice in case of disciplinary action, termination, and things like that. Another positive sort of intervention is the annual health examination. Annual health examination is to be conducted, it's under duties of employer, and it needs to be conducted free of cost by the employer. Now, initially, it was not restricted to a specific age or class or establishments by the code itself, but the rules, the draft rules, again, they're in draft state, so they're not like strictly applicable, they can be revised. But the draft rules say that it's only applicable to more than, people who are more than 45 years of age, and those who are employed in factories, dock work, mines, building, etc. But the provision itself doesn't prevent the mandatory annual health checkup for any kind of worker. And this can be quite useful, especially for informal sector workers, because it's really useful to have an annual health checkup and a health card where these, the occupational sort of diseases or occupational issues that are, if they're affected by, is recorded in some way. This is just a, illustration of the changes that have happened. So especially in case of working hours, because it's a little bit important. Under the Factories Act, the maximum was 10.5 hours, extendable to 12 hours by order of the chief inspector. The draft rules say 12 hours. Even in case of exemptions, the limit was 12 hours, in the sense that up to 12 hours. But now it can also exceed 12 hours. Again, this is only according to the draft rules, but the code itself puts the limit at 8 hours. So this is a little bit of a contradiction. Another area where state governments or, negotiate, or some issues with, some issues that can be also negotiated by the state government is that the manufacturing, if the manufacturing process is something hazardous in the sense that there is a serious risk of bodily injury, then welfare provisions can still be made by the appropriate government, which in many cases will still remain the state. So in those cases, you can still provide for rules related to welfare if you can say that the manufacturing process is a dangerous process or a dangerous operation. So for some, like I said earlier, there is centralization of powers, but there is this avenue in the case of dangerous operations. Women have been allowed to sort of also opt for night work. But of course, this is subject to the consent of the woman. Now, one of the areas where, again, you can have some leeway is prescribing how the consent should be given. So if we can include in the state law something like, okay, consent has to be given in this manner, and the woman should be allowed, it should be subject to these conditions, etc. For example, having other women workers around, or having the responsibility on some supervisor to ensure safety, etc., can also be included. In the draft rules, things like, in the draft central rules, things like adequate transport, well-lit facilities have already been mentioned, but this is again draft rules. One other provision is that in the case of creches, they have said that it used to be if you had women workers, but now they just use the term workers, which means that it doesn't need, the threshold level is not dependent on particular gender. It can be workers in general. But at the same time, I don't know if it's a but at the same time, it can also be a creche that is run by an NGO, municipality, or private entity, or by the government or state government. So these creches can be run by these entities as well. But the threshold limit has been changed from 30 women workers to 50 workers, irrespective of gender. But by far, I think, I mean, as you can see, it's a little difficult to sort of clearly say what are the things that are missing and what are the things that are especially problematic, because it's not that they have been entirely removed. It's that they have been, most of the safety and welfare provisions have been left to the rule-making power of the central government. And if you look at the draft rules, a lot of these safety and welfare provisions have not been mentioned in the draft rules. But of course, they're still in the draft stage, but they are not specifically mentioned in the draft rules. But regardless of all that, if we sort of go back to before these rules and the code itself came into being, and we go back to why these codes needed to be introduced in the first place, then in the matter of with respect to OSH, one of the major concerns was that given that India had a huge informal sector labor force, and given the fact that accidents and diseases were in some, according to some data, greater in smaller units who are outside of the ambit of Factories Act provisions, etc., etc., most of the discussions prior to the enactment of the code was towards the safety provisions for the informal sector. The DGFA, SLI, and ILO had undertook a joint sort of project to figure out how to have relevant occupational health and safety standards for the informal sector. And they had specifically pointed out that in the case of informal sector, OSH is practically non-existent. There was also the report of the Working Group on Occupational Health and Safety as part of the 5th year plan. They had also pointed out that, okay, Factories Act, there is some legislation covering occupational health and safety, but it doesn't cover the majority of the workforce. And so there is a need for some kind of OSH mechanism that covers not only the formal sector, but also the informal sector. This is the background for having new labor laws, which are applicable not just to a very limited amount of workers in the formal sector. This is true all over the world. They have general legislations for OSH that are not limited to certain industrial occupations. But if you look at the OSH code as it has come out now, it seems that there are, first of all, a lot of the specific requirements in the Factories Act, building construction workers, etc., interstate migrant workmen, etc., have been taken out. But at the same time, that has no, there has been no additional mechanisms for the informal sector at all. Now, for the informal sector, we need, most of these reports have always said that we need sector-specific regional occupational health and safety standards. Because the thing is that different sectors are, everybody knows that different states have different kinds of employments. Different employments have unique occupational health and safety concerns. So they have to be regionally figured out and they need to be specific to that sector. If you need that kind of regional focus, then having a centralized rule-making mechanism doesn't really help us. Again, specifically, there are more women workers. There is nothing about specific to the unorganized sector related to reproductive health of women workers or anything like that. And this is also something that is not just restricted to either the code. This issue, is not something that is just restricted to the code, but also an attitude towards the informal sector. So if you look at what kind of diseases or what kind of accidents are typical to the informal sector, we have no data. We have no national level data when it comes to these issues in the informal sector, where a lot of workers, where a significant majority of the workforce are engaged in. The only thing we have is in terms of silicosis, agriculture, a huge sector where a lot of workers work. Again, there isn't really any particular, there are some references in certain laws, but there are no, the only legislations that exist are the Insecticides Act and the Dangerous Machines Regulation Act, and they're usually managed by the Agriculture Department and not by the Labor Department. The DGFA SLI provides technical support to the Chief Labor Commissioner for Building and Other Construction Workers. But DGFA SLI, even though they may have knowledge when it comes to, or at least have attempted in some cases to extend their studies to the informal sector, have no power when it comes to enforcing the regulations. And Labor Department has limited sort of authority when it comes to the agricultural related legislations as well. So if we need to provide guidelines for informal sector, which was one of the stated aims of the labor codes that came out, then it is also necessary that we need to have a mechanism in place that is also suited to informal sector and smaller units. Smaller units in the sense that those that have less than 10 workers. If you look at statistics, I mean, if you look at statistics on the size of units in India, you'll find that more than 90% are under 5 workers per unit. So it means that even if whatever I said about occupational health and safety in the formal sector and the issues with the OSH code are eliminated, you would still need to make an OSH mechanism which could work for more than 90% of workers who are in the informal sector in India. One of the major sort of first steps in understanding that would be to have studies in the informal sector to figure out what the occupational diseases are, what kind of accidents happen, etc. And then one of the major sort of demands has been to have an annual health checkup extended to informal workers with a health card, so that the informal workers are informed of what diseases they are contracting due to their occupation. And the health card itself can also serve as sort of a starting point in figuring out that, for example, in the construction sector, silicosis is a big issue. So then if a construction worker has a health card, then it kind of helps us to sort of identify that, okay, in this sector, it seems like workers are always getting exposed to silicosis related lung diseases, etc. I use silicosis because it's the only disease where there is already some national level study available. But when more data is available for informal sector, then we can sort of develop a mechanism for OSH for informal sector as well. And this is one of the major issues with the OSH code, which is that it was sort of the stated aim was to extend labor law to informal sector as well. But if you look at it, a lot of specific provisions for the formal sector have been removed, but no additional provisions have been introduced for the informal sector either. That's the end of it. Now, if you have any questions.
Thank you, Jasun. Unfortunately, the place I am right now, I have some electricity issues. So
Okay.
it's raining and then we are having power cut. So, but you have made my task easier by explaining too many things in detail. To summarize, for the benefit of our friends who have been hearing Jasun, the key points are very clear. I mean, it is indirectly strengthening the contract labor. I mean, it's in effect. So we go back to the same thing. I mean, all the labor codes seem to be having very identical problems. Everything is boiling down to the issue of ease of doing business. So it's all trying to facilitate the ease of doing business theory, and then accordingly, all these things have been trimmed. So basically, once again, this is strengthening the contract labor mechanism. And again, we have the problems like the other labor codes. We have this problem on definitions, confusing people with employees, worker, what worker is, what employee is. Also on the ambiguity in the concepts used in this whole text. Then also the major concern which the labor unions need to take up is the threshold issues. So what is the realistic threshold that needs to be taken up? I mean, which to be supported, because earlier thresholds are they really insignificant? What are the problem with the new thresholds? The change in the thresholds, whether it is being changed from 10 to 20 or 20 to 40 or 50, all these thresholds very clearly shows a trend in exclusion. At least, I mean, some of these codes will exclude 90% of the informal sector workers by the simple mechanism of thresholds. So the trade union all the trade unions need to take this seriously and rework on these issues of changes in thresholds. And several protections have either been diluted or removed. That is what is very clear again and again. And as Jason had clearly mentioned about the changes in allowances, how this journey allowance has been allowed and not the, I think it's the displacement allowance which has been removed. So these, in a way, many of the enabling provisions also have perished. And then with this new trend of virtual mode of inspection through web-based thing, it is very difficult because when physical things are not working, then the digitalization can be subjected to manipulations, and manipulations in terms of maybe not in the smaller level, but we have enough proof of people playing with algorithms and the change of games with that, and you use the games through artificial intelligence in these things. So these are crises. It's leading to further crisis. So the moment it leads to further crisis, then the question of law, applicability of law, and the burden of proof on the people who are working on this issue become much more serious. So it is these are the things which I think what Jasun had shared is very important for us to understand, and this is a very important presentation. I'm really thankful to Jason to have gone in this detail to enlighten us with these informations. So if there are some questions, and no, it's not basically questions, some clarifications out from our friends. So I would request either Chinmay or Mithali to help us with reading out those questions, because with my electricity issue here, I would not be able to do that. So if Chinmay or Mithali can help us, it would be nice.
Sure, sure. So, Jasun, should I read out the questions first and then you would like to answer them? Or would you like me to read them one by one and you have to answer?
Whatever you prefer. I can also see the questions, so I don't know.
Okay, I'll read them out anyway.
Okay.
So, first couple of clarifications. Lizzie Joseph is asking, in the context of Interstate Migrants Act, how is the allowance per journey done away with?
So basically what they've done is, of course, the court repeals the Interstate Migrant Workmen's Act, and then the similar provision is not there in the final OSH code. They have mentioned displacement. There is no reference to journey allowance, which means that, the original provision is repealed and there is no similar provision in the new code. So they have done away with it completely.
If the rulemaking for OSH is done by central government, what is the role and responsibility of the state government?
That's that's what has happened, that they have taken section 18, section 23, section 24. They have spoken about OSH standards, health, working conditions, etc. Everything will be determined by the central government. So till now it used to be with, with state governments had rule-making powers. Now they don't have rule-making powers. And if you look at the draft rules that have come out from the central government, there is no reference at all to safety standards of the nature that already existed in the Factories Act, Building Construction Workers, etc. So it's not there. There are only some very limited avenues where the state government can still sort of make some inroads, which is, I mentioned, dangerous operations and welfare facilities in the case of dangerous operations, again, not safety standards. Appointment letter to some extent, but again, it will be really difficult to put these kind of terms and conditions in the appointment letter, but these are very, very limited things. Rest is all with central government. Role, I don't know then. If it is with the central government, then I guess the role of the state is limited.
I wanted to one question. Excuse me. Yeah, any survey of the OHS code, any survey take it depends upon the each unorganized workers. Even I asked the domestic workers. We are the domestic workers not included any code. And minimum code, then social security code and OHS code. But they are affected lot of problems from the houses, lot of sickness also. But in our ILO convention expressed 69 the 69 diseases is they expressed. But in our central government only 27 diseases only expressed. We want to each work, even domestic work, construction work, and fishing work, all the works, each works they take they concentrate according to the work how much they affected from the disease, which disease they are affected, quarry workers affected, then factory workers affected. Each worker they will take it. It is not common disease. It is a quarry workers, their lungs affected. Factory workers, then they are also the lungs affected. Then fishing workers, lot of problem. They have they lost their eyes and nose problem. Even sometimes their cancer also they are getting. Now our domestic workers also they affected kidney problem, heart problem, lot of problems. But we need the OHS code. Each workers how much which are disease they affected. This is the survey is not clear in central government level. But we no need after the for code. This we will always they are against that one. They return to the government. It is the better. Okay.
So that was Sister Claire from National Domestic Workers Movement.
I mean, I don't know if that was a question because that's exactly what, there is no study conducted in the case of unorganized workers. Apart from the ILO list of diseases that ma'am mentioned, there isn't really anything that we can even rely on. There is no national level study for unorganized sectors, including domestic work. That should be the starting point. And then you should have sector specific, particular unorganized sector specific occupational health and safety standards and working conditions, ways of figuring out diseases, like I said, but it's not there in the code. So I agree.
Thank you.
Is there any other specific question?
Now I am last only. I came. Sorry, I went out of the station. So
No issues, sister. No issues.
Yeah, my question is my question. We no need after for codes. How much we are struggling, how much the unions, the beginning, they are getting lot of legislation for the laborers. They destroyed all the legislation. Only they supported to the hierarchy people only. But they never think, they should not thinking about the enormous workers and the low level workers. We want we will think they will think the enormous workers and the low level workers. Then only we support that code. Otherwise we can't do. And even one time when we spoke about our meeting, before 1996, all the parliaments they spoke about the laborers only. But now today nothing. Anybody is not concentrate the laborers issues. So we want enormous problem, enormous sectors affected lot of the things. All the workers, all the level.
Yes, sister.
All the level. Okay, we concentrate that we don't want that code. Then the central government return to the code. It is we will try. All the groups are working together. Okay.
Thank you, sister. Thank you. Thank you for sharing your opinion on the generally on the labor codes. But with specific to what Jason presented today, are there any specific questions by others? If there is any specific question to this particular code, then it will be useful because we are trying to go more focused on each of the specific codes. So in the specific codes, like one thing which was very clear in Jason's presentation is that there are also these issues of contradiction between the code and the rules. So that has to be taken up seriously, and we have to work on it further. And this another thing which is very special about this code is that this is the one of the two codes which the BJP's trade union, the Bharatiya Mazdoor Sangh, also opposes. So they oppose two codes and they support two codes. So this is also a code which Bharatiya Mazdoor Sangh also opposes. So that is one thing which for us as a strategic angle, it is also important for us. So I would like to invite if there are any specific questions before going to the comments part on this particular code, so that we can discuss with Jason on that.
Sundar Babu and Jasoon, there are some questions raised by Sister Lizzie. So I would like to ask Sister Lizzie if you want to present those questions. And also there is one question raised by Bhargav. So Sister Lizzie and Bhargav, if you can ask this question directly, then we can have a discussion.
Or if possible, you can read out, Chinmay, if they are not audible.
Okay, so there were like many questions by Sister Lizzie. So one question, so two questions Mitali has already asked. One more question was she's asking that does extra hours of work means also overtime for the same? What does the code say about it? And annual examination is to be done where? Public or private hospitals? In case of any occupation health hazards, will the employer pay for the treatment? And I will also like to take Bhargav's question so that Jasoon can reply to it. Bhargav's question was, what will be the role and powers of State Labor Department in the application of OSH code? And as it is the central government which will be the concerned authority, will they be rendered powerless or as far as making amendments in the code is concerned? And also he was asking, like, even if we gather data about small unorganized sector regarding OSH, where do we take it? DGFS, FASLI or State Department? Where exactly? So these are some of the questions raised in the chat box.
Okay, thank you. So one sec. So I kind of one sec. Let me also look at the chat box because I forgot what the first question was.
First question was for working hours. Yeah.
Extra hours of work. So yes. So again, this is an area where there is a little bit of a conflict between the code and what the rule says. So the rule says that it is, I mean, the code says that it's up to 8 hours in clause A. And clause B, it talks about rest and intervals should be spread over in a way that can be prescribed by the appropriate government. So what the draft rules have said is that they have ignored clause A. They have made a rule under clause B saying that if the spread over shall be 12 hours. So again, it's a little bit of a conflicting sort of ambiguous sort of thing that they have done. But they also mentioned that there will be overtime pay at double the wages that, as is the standard for overtime. So overtime wages will still be applicable. And it also says that overtime will depend on the consent of the worker. But it's I don't know how far that is effective, but it is a place where there is some ambiguity even in the code. Then the next question, annual examination, they don't really say whether it is public or private hospital. The rules and the code just mention that it has to be done by a qualified medical professional. So that's what it says. In case of any occupational health hazards, will the employer pay for the treatment? This I'm not sure, because again, it will have to depend on the, not in all cases, but in case of occupational health hazards that are specified in the occupational diseases section, then yes, the employer may be liable to pay for the treatment. But like I said, there are so many exclusions in the code. So not for all occupational health hazards and not all employers. State labor departments in application of OHS code, as it is central government will be the concern, will they be rendered powerless? So as far as making amendments in the code, yes, as I said, the state government is limited in its authority. Even though labor is in the concurrent list, we know that if the central government comes out with a law, then the state government can't really go against that law and make amendments to that law, because that aspect has already been occupied by the central government, in the sense that it's a that area of lawmaking has already been done by the central government, so the state government can't really make amendments in that regard. And like I said, most of the rule-making power is also now with the central government, which means that the state government will still be limited in its rule-making power. When it comes to the labor department, of course, there are still powers for inspector facilitators, as it is mentioned in the code. They can they still have, although it is based on web-based inspections, you can still conduct inspections, you can still conduct surveys, etc., but with the consent of the employer, but surveys with the consent of the employer and inspections through the web-based system. So in that limited way, labor departments will still be relevant. Even if we gather data about, sorry, I thought I heard something. Even if we gather data about small and organized sector regarding OHS, where do we take it? DGFA, SLI or State Labor Department? This is a question of strategy, which I can't really answer. Right now, like I said, unorganized sector is completely ignored in the code. So DGFA, SLI is one institution where I found that they have done some work in trying to figure out what are the occupational diseases in the informal sector, but they provide technical support. Like I said, it's not like they have the enforcement power, is even with building and construction is with the Central Labor Commissioner and this thing. I think that's a union strategy for unions kind of questions, which I don't really know the answer to. A lot of people work with the health department also. For example, I know that in Tamil Nadu, a lot of some organizations at least are working with the health department and trying to figure out, in case of informal occupations, what are the diseases that keep reoccurring and things like that, and trying to sort of develop a list of diseases. But I guess within the law, we don't really have any one authority. Purpose of bringing labor code was to amalgamate. I think this wasn't read out, but anyway, can we say that and assert that labor codes are not an amalgamation, but conveniently done all right as well? Okay, I think.
That's our opinion. That's a comment.
Oh, okay. I Yeah, I mean, we can say that the stated aim was always to, if we look at the documents before the enactment of the codes that the government had, they all mention about informal workers and how none of the laws apply to informal workers. Then we look at the codes, and then there is no extension, no substantial provisions that are extended to the informal workers, which means that, I mean, arguably then the stated aim of the codes fail. So we could definitely say that. Yeah.
Are there any specific questions other than comments? Comments we can hold it, but if there are any specific questions.
Samuel has a question. He has raised his hand.
No, thank you very much. Jason, it's been very nice to hear the complete details. My concern is very simple. In the name of benefiting the major chunk of the informal workers, that's beautifully written in their introduction. But what we see is that's just nothing at all. It's just remove the little things that we have already had for the past 100 years or more. I think this is something that we have to take note. Secondly, the concerns of many of us, especially Clarama was saying about domestic workers, and we are also working with the sanitary workers. You see the number of things that they removed. Even the protection gears not been allowed to give. The number of people who are going to work. And then you see the entire focus is on the contractualization of the work, which means the government doesn't want to be responsible in any way. So this is not the worker wanted, as the farmers were not wanting the formulas. These are the workers we wanted. What we want is social protection for all. What you have signed in the ILO conventions, from conception to graveyard, we need universal social protection, whether it is health, whether it is education, whether it is maternity, whether it is housing, whatever be the thing. So all these things, I think we need to club together, and then we have to wage a war. Actually, it is not fight even. It's something much bigger than that we need to do it. I think your presentation has helped us to understand where the gaps are or where the full hole is there, not even gaps. You've removed the little things that we had. I think this is what I want to appreciate, and then we need to work more, deeper and more specific items or sector where the visibility of such nonsense can be revealed much better. This is what I wanted to say. It. There's more than a question is for me, my concern.
Jason, I just have a small I need a small clarification from you. This is regarding to this safety committee. Is the threshold number 250? Is it 250 or 500? There was some change in the threshold.
There was, in the rules it says 500 now. Yes, in the rules it says 500 now.
And the code says it is 250. Because I remember reading it as 250, so I was confused with the number.
I am a little confused about the number as well, but in the rules, the final rules that came up, it said 500. But I do think there was also some reference to 250. But at this point, I'm sorry, I can't remember.
Fine. So is there any specific question, any other question? Because I think we are already over exceeding the time limit. So is there any other specific question, please? Otherwise, we can close it at this stage. I don't see any hands.
Sorry, I just looked it up. Initially, it used to be that 250 workers, then you have to appoint a safety officer.
Okay.
But no reference to safety committee. But in the rules, they have said that if you have more than 500 workers, then you have to appoint a safety committee.
So simply like it's just making everything out of the ambit. So it's going to be very difficult to get in the ambit of safety at workplace. So thank you, Jason. Thank you so much. I mean, you have given us a lot of input. I also want to take this opportunity to share that we have Working People's Coalition also has one of the sister organization to Working People's Coalition is the India Labour Line, which deals with real ground level cases, which is to the WASH issues. So since July 2021 onwards, more than some 40 critical work site accident cases have been dealt by the India Labour Line. So that way, it has been an important contribution from the Working People's Coalition network. So, including the Pune labs issue and the Mundra fire accident, all that we have been involved with. So, and they do have ground experience. Some of the questions when they asked about the practicality of the issues related to the hospitals and all that, they can definitely contact the India Labour Line to know more about those issues. So thank you so much. Thank you, Jason. It has been a pleasure. And I think I remember you from the Disconnecting People campaign, I think from the Nokia struggle onwards. So I've heard about you from there. Thank you so much for your valuable inputs right now. Thank you. Thank you, everybody. Thank you so much.
Thank you, Jason. Thank you, Sundar Babu.
Thank you all. Thank you all.